What is prescription drug abuse? Prescription drug abuse is the use of prescription medication in a way not intended by the prescribing doctor, such as for the feelings you get from the drug. There are three main types of prescription drugs that are most susceptible to abuse, including opiates or painkillers, central nervous depressants or anti-anxiety drugs, and tranquilants or relaxers. One of the most commonly abused prescription drugs is oxycodone, which gives users a blissful, heavenly euphoria that is almost unmatched in the narcotic world. Another commonly abused prescription drug is Adderall. It can provide people who have trouble concentrating miraculous relief. Adderall is primarily valued for its energetic, stimulating, and oftentimes euphoric effect. Another commonly abused prescription drug, which you may be a little more familiar with, is Xanax, which physicians prescribe for panic disorder, insomnia, and social anxiety. However, it appeals to many abusers as it relaxes them, supposedly releasing tensions or other stress reagents. Lastly, zolpidem, also prescribed by physicians for insomnic or sleep disorders, can have severe hypnotic and sedative effects on abusers. Common signs that a patient is abusing prescription drugs include frequent requests for refills from physicians, losing prescriptions and requesting replacements regularly, crushing or breaking pills, stealing or borrowing prescription medications from family members, friends, or coworkers, consuming prescriptions much faster than indicated, visiting multiple doctors for similar conditions, and inconsistent answers to questions about prescription usage.
Means number of things. Well, it could be that they are not taking the dose that is prescribed. That means they are taking more than what is prescribed to them, and they are not taking by the way it has to be taken. For example, if a pill has to be swallowed, they may crush it and snort it, or they may try to take it intravenously. So those are the ways where abuse can happen. So when we come to know that, the first thing is the patient safety. So we have to explain it to patient that this is not how you should be doing, and your health and actually your life is at stake. So we have to send them to a rehabilitation program and give them alternatives so that they do not go through withdrawal.
What are the effects on the body when used illegally? Symptoms of the abuse of prescription stimulants may include extreme agitation or irritability, irregular heartbeat, high blood pressure, elevated body temperatures not explained by environment or physical activity, seizures, cardiovascular failure, and insomnia, which may persist for many days at a time. Common symptoms of opiate abuse include depression, rapid decrease in blood pressure not explained by other medical conditions, disorientation or confusion in familiar surroundings, constipation or other digestive irregularities, and shortness of breath. In addition, symptoms of tranquilizer abuse include insomnia, paranoia, and sudden feelings of hostility. Not only is abusing prescription drugs alone dangerous, but mixing them can be equally as harmful on the body. For example, when you mix alcohol and Xanax, an anti-anxiety prescription drug, the effects can be quite dangerous. Common effects include impaired brain activity and communication with the rest of the body, along with severe memory loss. In addition, alcohol also enhances Xanax's ability to cause great confusion, greatly impaired judgment, and produce unusual behavior. Many efforts have been made in recent years to prevent prescription drug abuse. As of 2012, when pharmacists dispense medications, they must help patients understand instructions for taking them. Additionally, all drugs distributed by pharmacies must now also have a warning label listing all possible side effects of the drug and dangers it poses to the human body during overdose or abuse. By being watchful for prescription falsifications or alterations, pharmacists can serve as the first line of defense in recognizing prescription drug abuse. Some pharmacies have developed hotlines to alert other pharmacies in the region when a fraudulent prescription is detected. Moreover, prescription drug monitoring programs, which require physicians and pharmacists to log each filled prescription into a state database, can assist medical professionals in identifying patients who are getting prescriptions from multiple sources. Finally, it is likely for people to become addicted to prescribed drugs even when used legally or in control, as they may often long to feel the way they did when on the medication, whether it gave them energy, boosted their overall mood, or they just felt the need to take it regardless.